Hi guys, my name is Kaylee Williams. I'm a nurse practitioner student with Auburn University, and today we're going to be talking about orthostatic hypotension. So, orthostatic hypotension occurs when a patient is unable to maintain a normal blood pressure when rising from lying to sitting or sitting to standing. The pressure must drop greater than or equal to a difference of 20 systolic and equal to or greater than 10 diastolic from a patient's normal over a 3-minute period. Symptoms that may be present in a patient with OH include dizziness, lightheadedness, or syncope. The patient may or may not present with symptoms, but it is more common for the patient to be asymptomatic. Patients that take antidepressants, anticholinergics, antihypertensives, insulin, vasodilators, opioids, antipsychotics, or neurotoxic drugs are at a higher risk for experiencing orthostatic hypotension. Orthostatic hypotension can be idiopathic. It can also be related to Parkinson's disease, Guillain-Barré, chronic renal failure, cancers, certain cardiac disorders such as heart failure or MI, adrenal insufficiency, intravascular volume depletion, sepsis, and many other conditions. The elderly, people with multiple comorbidities, and those on multiple medications are all at higher risk for orthostatic hypotension. 3 questions we want to make sure we're asking these patients when they come into the office. Number 1, are you having any postural symptoms such as dizziness, lightheadedness, or palpitations? Making sure that we cover these signs and symptoms helps us be more specific to orthostatic hypotension and kind of gives us a better idea if this can be a definitive diagnosis for this patient. Number 2, have you been experiencing any vomiting, diarrhea, or feelings of dehydration? Volume depletion is a main cause of orthostatic hypotension. So, touching base with all of these things and kind of trying to decide, does this patient need IV fluids to help them with this orthostatic hypotension that they're experiencing? Number 3, have you recently fallen or experienced numbness or tingling anywhere? These symptoms can also be indicative of a diagnosis of orthostatic hypotension, obviously, but they also could warrant further evaluation to make sure that orthostatic hypotension isn't secondary to some kind of neurological issue that could be going on related to a recent fall. Describe the top 3 physical examination components. So when we're examining these patients, again, we want to make sure that the orthostatic hypotension isn't secondary to a more serious diagnosis. So number 1, we want to make sure that orthostatic hypotension is present, and to do that we're going to measure the patient's blood pressure while they're sitting and then have them stand and remeasure it. Again, for them to be diagnosed with OH, the drop must be greater than or equal to a difference of 20 systolic and equal to or greater than 10 diastolic from the patient's normal over a 3-minute period. We also want to make sure we're doing a good cardiac exam. Jugular venous distension, irregular pulse, edema, murmurs, and S3 sound are all indicative that this could be related to a cardiovascular issue. We want to make sure we're doing a good neurological exam, especially if they've complained of that dizziness, numbness, or a recent fall. That would include looking at their gait, are they having any tremors, problems with motor strength, fine touch, pain sensation. You could do the Romberg maneuver and also check for cerebellar signs. And these could all be symptoms that are signs that the patient might be experiencing the orthostatic hypotension secondary to a neurological problem. When we're teaching these patients that are diagnosed with this different treatments and ways that they can kind of fix this at home, one big thing that people like to turn to are compression stockings, and that just helps get that blood flow going, make sure the blood supply doesn't pull in those lower extremities. For mild orthostatic hypotension, we could just really encourage those people, take it easy. If you stand up too fast and you notice you're feeling really dizzy or lightheaded, sit back down, take a minute, see if those symptoms kind of go away on their own. Sometimes this isn't a severe enough problem to really need to treat, as long as you're sure it's not secondary to a more serious issue. If the orthostatic hypotension is tied to medication use, the nurse practitioner may want to consider looking at the medications that could be causing this. Maybe we want to decrease them. Maybe we want to try changing the medication. There's different things there that you could do medication-wise. We want to maybe increase small and frequent meals rather than just 2 or 3 larger meals. Increase fluid intake, salt intake, caffeine intake, and then medications such as Fludrocortisone and mitogen can both be used to increase vascular resistance if lifestyle changes do not resolve the problem. Thanks for listening, guys.